I received the International Mentorship Award for women who conquer cancer. So they try and fish out women like us who try and make sure that our young mentees achieve. And because we have a succession plan and hand over to our younger colleagues. So the award was just to commensurate what I do in terms of bringing up young oncology professionals in Africa. Not just physicians, but also nurses, pharmacists, physicists, just to improve the cancer care outcome in the country. Encourage them to pursue further studies and to make sure that they excel in their field.
Thank you. And would you be able to tell us a little bit about the main challenges in cancer care and research in Ghana?
The problems we have I would like to talk about Africa in general. The problem is that we don't have a lot of money to spend on research. The healthcare spending budgets are quite low. So research really is a big problem. We usually go into partnerships and collaborations to get a big research going. But at the same time, I believe that from just our small research that we can do at our basic levels, we'll be able to get a lot done to change the face of cancer care in Africa. Because what pertains in other countries does not really pertain to us because of our sociocultural poverty, and all kinds of things. We might not be able to come up with a state-of-the-art treatment, but it's important to manage with what we have to make sure we are giving the patients the best. When it comes to research, we still try now to encourage our young physicians to have like a research proposal in their examinations. That will probably go a long way to stimulate their interest in research. But I think a lot more has to do with that because we are not taught research in our medical schools, and that has to change. So, for example, in oncology, everybody knows oncology is a lot of research. So all our residents try and be on the ball to keep up with research and try to publish their own, just that in their small little way because it's different. But now a lot of people are getting more attracted to Africa, to what we offer. So there's a lot more interest in Africa, and I think this will be on a bigger picture eventually.
Thank you. Are there any current strategies that are trying to improve this?
I think with the IOTIC, which I'm the secretary, there's the Big Cat Awards with the NCI, and they're trying to promote sponsorship for young investigators. And I think this is the beginning of something big. But there are also a lot of collaborators with East Africa, South Africa, and other organizations coming into. ASCO is also helping with ASCO International with all the awards for the young investigators. But I think we need to push more for Africa because I saw very few Africans up there on the stage yesterday. So I think there's a lot to do with that. And I think AOTIC should be able to lead the way with encouraging this.
And is there any research that you're personally working on at the moment?
I think we recently published a medical oncology workload for Africans, and the results were striking that African oncologists are actually overloaded. They tend to be less satisfied with their jobs. They tend to see a huge number of patients per year, and then also they have very low job satisfaction. And I think this is something that should be looked inside seriously for policy to be able to attract more professionals into the oncology field because it speaks, a lot of volumes. I think it's the beginning of something, big coming out. And then secondly, also I'm working on a survey which I published about 3 years ago about cancer care on the continent. And there was a follow-up survey which is coming out soon, which shows quite interesting results that cancer care on the continent, for breast cancer particularly, is getting so much better than it was, even just within the span of 3 years. And that is quite impressive. And I think it's even much better than we actually, because we have a very low respondents rate for Africa. So I think it's even better than I really thought. And that's very exciting to see that we are getting much better. So.
Great. Anything else you'd like to add?
I just want to thank ASCO for giving me this opportunity to highlight what we do in Africa, because we are still a small continent, but there's a lot of potential out there that we should look at. Watch this space. We're coming up.